Welcome back to American Warrior Radio, right here on the Talk to Me station, AM 1300, and online worldwide at 1300WMEL.com. Folks, we encourage you to pick up your telephones and call everybody you know. Come on, you can listen and call at the same time. Tell them to dial us up on AM 1300 here in Central Florida. Our terrestrial signal reaches up into Volusia, over into Orange, I know past the airport, and down into Indian River, Glen. We got a pretty good signal.
You bet.
So dial them up, tell them to listen. If they're outside the broadcast area, they can listen to us live at 1300WMEL.com. Lots of good stuff to cover here. Glenn, we talked about the fact that earlier this week, combat operations in Afghanistan have come to an end and they lowered the flag. And you mentioned that we still have a large number of forces over there, some 10,000 plus, and even some over in Iraq. But for all those guys and gals that are coming back, and you know, we hope that they're not injured. We hope that they don't have disabilities or suffer from some neuropsychiatric disorder like maybe depression or post-traumatic stress. We hope that they didn't incur a traumatic brain injury, but you can hope all you want. A lot of them have. So what's your advice as the past supervisor of the Brevard County Veterans Service Office and the current team leader for claims processing with AVET Project and the American Legion Post 200? You know what you're talking about. What should these guys and gals that are leaving service, that are going to become veterans, what should they do regarding any issues they may have that resulted from their service?
Well, you need to get with an accredited service officer, such as myself, and you can reach me at Glenn, that's with two N's, GLENN, at AVETproject, altogether, .org. That's Glenn at AVETproject.org. And I do it by email initially, and then we'll set up an appointment to meet an American Legion Post 200. And when I get your email, I'll send you back what things I want you to bring, or find out what things you have that you can bring or what you don't have. And we'll go from there to get you started. Make sure you've got your 214. Don't throw that away because you're happy you finally got out of the military. Like 99% of the veterans I know, it seems like.
Hang on to your discharge document, please. And actually, if you have, let's say you have a copy of your service medical record. Before you exited the military, you went down to the med people, the medical corps, and said, give me a copy. That's good.
Yeah, they're required to give you a copy.
If you ask for it.
You know, and if you're out there listening and you have a son or a daughter that's still on active duty, a friend that's still on active duty, tell them to make sure they get a copy of their complete service medical treatment records. It's vital to maximize my ability to help you. Otherwise, we're going on what you tell me, or we have to wait a considerable period of time to get a copy of your service treatment records, and that's not always good. And besides, if we file within a year of when a person gets off active duty, the effective date of that claim will be the day they got off active duty.
So there's a lot of good information right there, folks. I want you all to understand one thing, though, about claims processing. If you are claiming a disability, first of all, and there's really a lot to cover here, Glenn, so I'm going to try and encapsulate it as best I can. It is essentially kind of an implied workers' comp agreement between our government and the military member.
Oh, absolutely.
Explain what that means.
Well, if you're working for a private firm, non-military firm, and you get hurt and you're a full-time employee with them, then you're going to be covered under workers' compensation. They're going to send you to one of the workers' compensation doctors that they deal with. And they're going to do an examination, determine what you have, determine if you might be able to return to work, and then you're going to get paid X amount of dollars while you're off from working. The VA is a little more generous than that, in that if you qualify, meet the criteria for whatever disabilities you're claiming, then they're going to assign a percentage to that, and if it's 10% or higher, you're going to get payments from the VA, unless you're a retiree, and then that's a whole different ballgame. We'll talk about that at a later date. just have to throw in there, as always, that you may get a 0% or several 0%, and those are valid service-connected disabilities. The VA's obligated to give you free medical treatment for those disabilities, but you're not going to get any money monthly from the VA unless you're rated 10% or higher. And remember, the VA rates in tens only, 10, 20, 30, 40. There's no such thing as a 12% disability.
Right, increments of 10. And the important takeaway there is if something happened to you while you were on active duty, and whether there was a line of duty determination or not, let's say you injured your ankle, you rolled your ankle and you tore a ligament or something, and it's still bothering you, and you're leaving service now with this ankle injury that didn't exist before you went in, and there's a whole bunch of different things. There's
more if and or buts affecting that too.
Right, but the idea is you know that something happened to you on active duty or was made worse, it pre-existed and was made worse while on active duty. You want to file a claim for disability compensation through the VA.
Yeah, and the key word here is that you were treated on active duty.
Very important.
Very important. And secondly, that it because you have it still now, that should indicate that it's chronic, a chronic continuing disability. If you had the flu, that's not going to qualify.
Right. If you had chronic bouts of sinusitis, you're over there in the sandbox, and for whatever reason your system is reacting adversely to that, and you've got runny nose and stuffy head and all that jazz. Our producer here is handing me a note about burn pits. We'll talk about that in a moment, because that's an important part of the process too,
exactly.
The registry for that. But we're simply talking about all these guys and gals that are coming back now that combat operations have ceased. Okay, combat operations have ceased in Afghanistan, everybody, in case you didn't hear. So all these guys and gals coming back that may have gotten injured while they were on active duty or diagnosed with a systemic illness. Give me an example of one of those.
You give me an example.
All right, diabetes. All right.
Yeah, okay.
If you got diagnosed with diabetes, or they put you on high blood pressure pills for hypertension, if you got some unresolved skin disorder, and we know leishmaniasis and so many of these different disorders result from service over in Asia, in Southeast Asia there.
Exactly. Sorry, I went brain dead there on the word
Happens to me all the time, Glenn. The idea is something happened to you, and you know it was related to service because you got treated by the medic or a medical doctor or a nurse or whoever. Somebody said, oh, that's a problem. Let me take care of that for you, and either prescribe pills, or maybe you had a surgery, maybe they fixed a broken bone, whatever.
Yeah, and don't forget it, if you're lucky enough to get a separation physical or a retirement physical, not everybody gets them for whatever reason, and I think as part of the military system, they give you this questionnaire. Well, they call you in actually and go through a questionnaire with you, not a full exam. They don't examine anything unless you say is a problem still. So if you got still a problem, don't be so happy about getting out of a combat theater or getting out of the military that you forget to tell them the problem you have, or you're shooting yourself in the foot and blowing off all your toes.
All you veterans out there, especially those that have gotten their actual service medical record, they're calling them service treatment records now.
Right.
SMR/STR, same thing. It's your medical record while you're on active duty. You can go through there and you're going to find those physical exams, you know, whether we were considered worldwide qualified or not, or maybe we were on a profile for a while. Somewhere in your medical record, you're going to find that long list with little tiny check boxes, everything from an eye problem to whether your feet were itchy. I mean, just goes on and on. And what you're saying, Glenn, is they need to make sure before they leave service that they check all the boxes that might apply.
Right, and if you got some kind of chronic continuing condition you were seeing before, you don't like to go to the hospital, to the clinic and get treated for it, the time to go is before you get off active duty. Do it.
And let's say, for instance, let's say a gal is coming back from Afghanistan, and she's leaving the military, and the doctors in the military wrote this script for her. Let's say it's for depression, Glenn. Okay, that tells us a lot. As a claims officer, you know a lot just from that, right?
Well, yeah, you've got a firm diagnosis and you're getting medication for it.
Which means it's ongoing.
It means it's ongoing, and once we file the claim for you, then the only question at that point in time should be for the VA, not that whether it's service-connected or not, but how serious is the problem today. And they'll call you in for an exam.
Which is called?
Which is called a comp and pension examination, compensation and pension, and determine what symptoms you have currently, match that up to the table of disabilities, and determine what percent is appropriate at this point in time.
Right, and it can change. It can get better. They could ask for a review examination down the road, or you could, if you notice, let's say that hypothetical I threw out there, this poor gal experienced, let's say, again, these are hypotheticals, but unfortunately all too true, a military sexual trauma. Maybe she was harassed, maybe, I mean, anything could have happened, and she's on medication for it, and instead of getting better, she's getting worse, Glenn. So that's an indicator as well that if somebody receives a rating through the VA, let's say she was rated 10% based on her symptoms at the time of that C&P exam you mentioned, but 3 months later she goes into a deep depression and the doctors are scrambling to come up with another chemical cocktail to give her. Should she ask for reevaluation?
Oh, absolutely. And unlike the military gave you 10% for depression in this same example we're using, and the VA ends up giving you 10%, and the VA may or may not give the same percentage when you apply to them. But let's just say for this example, the military gives you 10% and the VA gives you 10%. Huge difference. You got worse, like Garen's talking about, you can apply to the VA for reevaluation. They're obligated to call you in for another comp and pension examination to determine if it's gotten worse. They could determine it got better, but you would know the risk of that just from the internal problems that you're having with it. But you can't ever go back and get the military to change what they've given you. So that's a huge difference.
Exactly. So again, we're dealing with all these vets, well, soon-to-be vets, coming back from Afghanistan, these military members that are going to be reintegrating back into civilian life because they're leaving the military, whether it's the Army, Navy, Marines, Coast Guard, wherever, whatever branch they're associated with, whether they go through a separation physical or not, we know that's a good thing, and check every box that might possibly apply because that helps cement the record in the file.
That's right. And you know, another thing, if you're filing for reevaluation, particularly if you're a male, because it's known that males don't want to tell doctors something's wrong with them. Don't go there and say, when they say, how you feeling, say, oh, I'm having a good day.
Yeah. And we're not saying that...
When every other day of your life is terrible.
Or 10 minutes after you leave the office, you go into that funk. Just kind of be very careful how you present yourself, both with the military authorities that are giving you your discharge exams and the VA folks. What I want to focus on right now, though, because combat it connotes that you're in a serious situation where traumatic events could happen any day, all the time, probably.
Yeah, and pretty much like the two-star general we talked to in Iraq when we were still in Iraq, everybody who's in the combat theater is at risk. So you're pretty much going to know that from talking to everybody that's already assigned there when you get there. You can be in fear of your life just by simply being stationed in a combat theater.
Exactly, and that carries over. It doesn't just, you don't leave it at the door when you leave service.
Unfortunately, that's true.
So let's talk about that one issue, because I know it's very mainstream right now, the post-traumatic stress disorder. They throw numbers out all the time, these statisticians and what have you, but right now it's kind of like 1 out of 5, about 20-some% of our combat vets will be afflicted with post-traumatic stress disorder. What does that tell you, Glenn?
Well, it tells you that the troops over there in combat theaters do experience things out of the ordinary that normal well, not normal, that's not maybe
Well,
a good word.
out of the realm of normal human experience.
Out of the realm of normal human experience, that's what I was trying to fathom up there.
And it has a lasting impact
And
on
it
their
has
brain.
a lasting impact. It still continues to bother you. You may experience nightmares. You don't like to be around people. You have marital issues. You have problems getting along with your children. There's a whole host of things. You're unable to hold down a job. Just on and on. Problems that you have, which are symptomatic of post-traumatic stress disorder.
And I want to mention,
And it's not curable.
exactly, they treat it, and you learn to cope. You get coping skills, and there's different treatment modalities. AVET projects, PR&R retreats, Project Recuperation and Reintegration changes lives, I'll tell you that. And one of the ways we do is by bringing to the forefront all these non-pharmacological, these alternative modes of treatment, everything from alpha stim to EMDR to infrared, heat and light therapy, massage. All these different things can be used to treat it.
Yeah,
but post-traumatic stress is not something that you cure.
No, not so far. Nobody's come up with anything that cures it, and when we have Dr. Fairchild on, he'll foot stomp that.
And can I foot stomp something? We're going to have a regular segment with Dr. Fairchild and Dr. Ken Vihek, hopefully, called, well, we're working on the name. But
Yeah, we'll come up with a good name. Catchy
we're working
phrase.
on it. And it's going to be the fourth Saturday of every episode of American Warrior Radio. So be tuned for that. That's coming up just shortly. But getting back to this, Glenn, we have one indicator on their DD-214 that the VA must look at when they're filing a claim for post-traumatic stress disorder, because a lot of them will. We already know, 20%, 1 out of 5 of them is going to file a claim or be eligible to file a claim.
Exactly.
And if they have one of these things, then the VA must concede they were in a stressful situation.
Yeah, let me say that again. The VA must concede that you have a stressor, and that's one of the requirements of the Diagnostic and Statistic Manual that required to be had for a firm diagnosis of post-traumatic stress disorder. So listen up. If the veteran has received any of these combat declarations, then they concede that the veteran has met the stressor requirement. So listen up. Air Force Achievement Medal with a V device.
For valor.
Right. Air Force Combat Action Medal. Air Force Commendation Medal with a V device. Air Force Cross, that's way up there. Air Medal with V device. Army Commendation Medal with V device. Bronze Star Medal with V device.
Because there's a Bronze Star without a V and it doesn't qualify. We won't see the stressor.
That's correct. Combat Action Badge. Combat Action Ribbon. Note, prior to February '69, the Navy Achievement Medal with V device was awarded instead of in the Navy instead of a Combat Action Ribbon. Combat Air Crew Insignia. Notice the word combat all through. Combat Infantry or Infantry Badge, and that's Combat Infantry Badge. Combat Medical Badge, that's for the medics. Distinguished Flying Cross, Distinguished Service Cross, Joint Service Commendation Medal with a V device, Medal of Honor, goes without saying, Navy Commendation Medal with a V device, Navy Cross, again, that like the Air Force Cross is way up there, a Purple Heart, and or a Silver Star.
So, and one thing you mentioned there, the Purple Heart. As you said, all those have combat woven throughout them because the VA is going to say, oh gee, this gal, this guy has one of these medals. We know that they were in a stressful environment.
That's right, and they meet the stressor requirement for a diagnosis of post-traumatic stress disorder.
Anybody with a Purple Heart already has their stressor seated. So the VA has no business even asking if they were in a stressful environment. It's a matter of finding out, do they have a diagnosis? Has a doctor said, hey, you've got post-traumatic stress disorder, here's a script.
Yeah.
That's pretty much it. Let's get some therapy going. So then you've got a well-grounded claim with the VA for compensation regarding your PTSD.
That's right, and
But you shouldn't do it on e-benefits. You need to go see a credentialed, accredited service officer that can make sure you put together an FDC. What's an FDC?
A fully developed claim, because those only take 6 months and the regular claims take 12 or 15, who knows?
Exactly. So that's
some of that depends on how many you claim. I want to throw, how many disabilities you claim I throw in there.
We've covered a lot of ground here, but we're already running out of time on American Warrior Radio, and I think this segues right into what the word we have to get out about not just the veteran, but even a family member. If you're a veteran, whether you're combat or not, and you're experiencing a crisis, you've lost hope, you think that the end is near, you've got to take your own life, don't do it. 22 to 23 veterans a day are taking their own lives. It's a national tragedy. Nobody's saying anything in the national media or press. Well, you're hearing it here on American Warrior Radio. Glenn, what is it you always say about suicide?
Well, suicide's a permanent solution to a temporary problem. Come on. You know, don't do yourself in. That's crazy.
And support
Doesn't mean
AVET
you're
projects.
crazy. It's just, don't do it.
And our PR&R program, like I said, saves lives too. So you support us. Go to avetproject.org, click on the donate button. We desperately need money. But Glenn, if they're in that crisis mode, what should they do?
They are a family member or a close friend. Call the Veterans Crisis Line, 1-800-273-8255. Press 1. That's 1-800-273-8255. Press 1. And we want to make sure you stay tuned with us. Next week, maybe we'll get to some education benefits that have just changed. One particularly that benefits spouses. And real quick, you cannot transfer your GI Bill to your family while you're off active duty. You have to do it on active duty, and there's some stipulations.
As always. But as always, Glenn,
don't forget, thank a vet.